anterior abdominal wall. And as usual, I'm going to be giving you outlines on how to answer questions on the anterior abdominal wall. First, we are going to introduce it. We'll talk about the lines that we can find in the anterior abdominal wall, its regions, the bony landmarks, surface landmark, structures, layers, and the blood supply that can include the arterial supply, venous drainage, nerve supply, and lymph drainage. I'll go ahead to talk about the organs that we can find in the anterior abdominal wall, its varation, and the clinical anatomy. So let's introduce the abdominal wall. The abdominal wall represents boundaries of abdominal cavity that provide flexible coverage to the abdominal wall and protects the organs that we can find in the abdominal wall from. So the abdominal wall is a complex layer that has its unique structures and functions. So it has a lot of layers that we're going to be seeing in the course of this class, and it has its unique structures and functions. Now what is split into two. So we have the anterior abdominal wall and the posterior abdominal wall. So in the course of this class, we'll be discussing the anterior abdominal wall. So let's talk about the lines of the anterior abdominal wall. There are various lines that we can find in the anterior abdominal wall. The first include the costal margin. So this is the costal margin, and this line is being formed by the costal cartilage of number 7, 8, 9, and 10. The second line we can see is the linea alba. So this line is seen in the midline of the anterior abdominal wall, and it extends from the xiphoid process down to the pubic symphysis, okay? Down to the pubic symphysis. Then the next line is the linea semilunaris. So this line forms the lateral margin of the rectus abdominis muscle. Now, in the course of this class, you're going to find out that there are various muscles that we can see in the anterior abdominal wall, which consists of 3 oblique muscles and 2 vertical muscles, okay? And the rectus abdominis muscle is one of the vertical muscles that we can find in the anterior abdominal wall. So the semilunaris forms the lateral margin of the rectus abdominis muscle. Now, the next line that we can see in the anterior abdominal wall is the inguinal ligament. So this is the inguinal ligament, and it's being formed by the lower border of the external oblique aponeurosis, okay? The next one is the arcuate line. So this arcuate line is formed by the lower border of the internal oblique aponeurosis and the transversus abdominis aponeurosis. Now this arcuate line is a line that is seen between the umbilicus and the pubic symphysis, okay? Now the next line, which is a very important line that we can also see in the anterior abdominal wall, is the McBurners line, okay? This is the McBurners incision. Now at the McBurners point is where we can see is a landmark for the identification of the base of the vermiform appendix, okay? Base of vermiform appendix. So this is a landmark for the identification of the base of vermiform appendix. And the McBurners incision is a place where the surgeons actually make an incision when they want to carry out appendectomy. So that is for the McBurners incision. So in summary, the lines that we can see in the anterior abdominal wall is the costal margin that is being formed by the costal cartilage number 7 to 10. Then we are having the linea alba, which is a line that is seen in the midline of the anterior abdominal wall, extends from the xiphoid process down to the pubic symphysis. Then we are having the linea seminaris, which is a line that is being formed by the lateral margin of the rectus abdominis muscle. We have the inguinal ligament, which is being formed by the lower border of the external oblique aponeurosis. We have the arcuate line, which is formed by the lower border of the internal oblique aponeurosis and the transversus abdominis muscle. That's the aponeurosis of the transversus abdominis muscle. Then we have the McBurners incision. At the McBurners point, it is a landmark for the identification of the base of the vermiform appendix. Then at the McBurners incision is the point where surgeons make their incision during appendectomy. So when they want to carry out a surgery that involves appendectomy, they go through the McBurners incision. And this line extends from the anterior superior iliac spine to the umbilicus. So the next we're going to be looking into is the regions that we can see in the anterior abdominal wall. So talking about the regions of the anterior abdominal wall, the anterior abdominal wall presents 9 regions that is separated by 4 quadrants. Okay, so we have the upper quadrant and the lower quadrant. So this is the upper quadrant and the lower quadrant. So the upper quadrant has the left and the right upper quadrant, while the lower quadrant has left and right lower quadrant, which makes it what? 4 quadrants. Okay, so upper quadrant, right upper quadrant, and left upper quadrant, right lower quadrant, and left lower quadrant. So the regions are 9. So let's start by this: 1, 2, 3, 4, 5, 6, 7, 8, and 9. So this is the right what? The right side. So this is the right. Anything here I'm going to be calling the right. So here is the left. Okay. So now let us label the middle part. So the first in the middle is number 2, which is the epigastric region. Now when you are going to be discussing the gross anatomy of the stomach, you find out that the location of the stomach is in the epigastric region, the left hypochondriac region, and the umbilical region. Please watch my video on stomach so that you can understand this better. Now the regions of the anterior abdominal wall will determine the lying of the visceral organs that are found on the anterior abdominal wall. Okay, so it's good for you to understand the regions of the anterior abdominal wall, because I'm going to be talking about, in the course of this class, we are going to be talking about organs that we can see in the various regions. Some organs can extend from one region to the other, just as I've given you an instance with the stomach. Okay, so the stomach covers this: the epigastric region, the left hypochondriac region, and the umbilical region. Always be specific. Always be specific, okay, when you're trying to label the regions that are not in the middle. So the first one is the right hypochondriac region, okay? So this is the right hypochondriac region, and this is the left hypochondriac region, obviously, the left hypochondriac region. So the middle, we are having, this is the umbilical, that's the umbilicus, okay? So this is the umbilical region, that's the umbilicus. Then we are having the lumbar region, right and left respectively. So here we are having the right lumbar region, and here we are having the left lumbar region. So here is the left lumbar region. So for the last part, we are having, this represents the hypogastric region, okay? So this is the hypogastric region, and we are having right and left iliac region. So this is the iliac region, okay? This is also the iliac region. That's the left iliac region. So left iliac region, right iliac region, okay? Now at this point, you're having the vermiform appendix. Vermiform appendix is staying in the right iliac region. So let's go over it again. The anterior abdominal wall has 9 regions that are separated by 4 quadrants: the upper quadrant, right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. So the 9 regions include: region number 1 is called the right hypochondriac region, region number 2 is called the epigastric region, region number 3 is called the left hypochondriac region, region number 4 is called the right lumbar region, region number 5 is called the umbilicus, region number 6 is called the left lumbar region, region number 7 is called the right iliac region, region number 8 is called the hypogastric region, and finally region number 9 is called the left iliac region. And I've said initially that this region determines the location of the visceral organs that we can see in the anterior abdominal wall. So having talked about the regions of the anterior abdominal wall, let's get to the next one, which is the body landmark of the anterior abdominal. So let's talk about the body landmarks that we can see in the anterior abdominal wall. The first includes the xiphoid process, and the next include the costal margin formed by costal cartilage 7 to 10. Then we are having the iliac crest. So this is the iliac crest. And we are having the anterior superior iliac spine, so which is represented here, the anterior superior iliac spine. Then the next you are having is the inguinal ligament. This is the inguinal ligament, and this ligament extends from the anterior superior iliac spine down to the pubic tubercle or the pubic crest. So this is the anterior superior anterior iliac spine, and this is the inguinal ligament. Okay, so the inguinal ligament is being formed by the lower border of the external oblique aponeurosis, and it extends from the anterior superior iliac spine down to the pubic tubercle and the pubic crest. So the bony landmarks that we can see in the anterior abdominal wall include: 1, the xiphoid process, the costal margin, the iliac crest, anterior superior iliac spine, inguinal ligament, pubic tubercle and crest, and the pubic symphysis. So let's talk about the surface landmark that we can see in the anterior abdominal wall. So having talked about the bony landmark, let's talk about the surface landmark of the anterior abdominal wall. So the surface landmark include the umbilicus, okay? The next is the linea alba that I already told you extends from the xiphoid process to the pubic symphysis, and is a line that runs in the midline of the anterior abdominal wall. Now the surface landmark of the anterior abdominal wall present boundaries. So this boundaries has a superior covering and an inferior covering, okay? So superiorly, the anterior abdominal wall is being bounded by the costal margin, which is being formed by costal cartilage of 7 to 10, as I've said initially. Then inferiorly is being bounded by the iliac crest, the anterior superior iliac spine, inguinal ligament, pubic tubercle, and the pubic crest. Okay, so let's go over it again. The surface landmark of the anterior abdominal wall includes the umbilicus and the linea alba, and it presents superior boundary and inferior boundary. So superiorly, the anterior abdominal wall is bounded by the costal margin formed by costal cartilages. Okay, and inferiorly, the anterior abdominal wall is bounded by the iliac crest, the anterior superior iliac spine, the inguinal ligament, pubic tubercle, and the pubic crest. So having talked about that, let's talk about the structures of the anterior abdominal wall. So talking about the structures that we can find in the anterior abdominal wall, they include the skin, okay, the superficial fascia that has a fatty layer and a membranous layer. So we have an outer fatty layer and an inner membranous layer. And that fatty layer is called the campus fascia, while the membranous layer is called the scarpus fascia. It consists of muscles, and the anterior abdominal wall has 5 muscles, 3 oblique muscles, and 2 vertical muscles. Okay, so the 3 oblique muscles include the external oblique muscle, the internal oblique muscle, and the transversus abdominis muscle. So we have external oblique muscle, internal oblique, and the transversus abdominis muscle. Now the 2 vertical muscles include the rectus abdominis, okay, and we have the rectus sheath that encloses the rectus abdominis muscle. Please watch my video on the rectus sheath. I'm going to be leaving the link in the description below, and I'm also going to be attaching the link at the end of this video. So we have the rectus abdominis muscle and the pyramidalis muscle. So this pyramidalis muscle may not always be present, okay? So that simply means that it's not all individual that has the pyramidalis muscle, but we'll look into these muscles in the course of this class in details, okay? The pyramidalis muscle. Now the next thing we're having in the structures of the anterior abdominal wall are the blood vessels, which I'm going to talk about in the course of this class. That's its arterial supply, venous drainage, nerve supply, and the lymph drainage. Now the structures are this thing that I just listed: the skin, the superficial fascia, muscles, and blood vessels. Now it's different from the layers. The layers are ways in which the things we'll find in the anterior abdominal wall are arranged, okay? Now, the layers of the anterior abdominal wall consist from outside to inside. From outside to inside, we are having outside to inside. Okay, that's from outside to inside. We are having the skin, okay? The superficial fascia, which includes the fatty layer as well and the membranous layer. Same thing that we can see in the structure. And it's also referred to as the campus fascia. That's for the fatty layer, which is on the outer part, and the scarpus fascia, which is the membranous layer, which is in the inner part. I want you to note that the anterior abdominal wall do not present a deep layer, okay, a deep fascia. There's no deep fascia in the anterior abdominal wall. This is to allow the free movement of the organs that we can find in the anterior abdominal wall. Okay, so that's why immediately after the superficial fascia, you are going to see the muscles. So what stands as a deep fascia in the anterior abdominal wall, which is not really a deep fascia, is the inner scarpus fascia, okay, which is the membranous layer. So the next layer we are having is the muscles, which I already told you that there are 5 muscles of the anterior abdominal wall, 3 oblique and 2 vertical. Then we are having the transversalis fascia, okay? This transversalis fascia is the fascia that's going to be separating the transversus abdominis muscle from the peritoneal fat, okay? Now we are having the peritoneal fat and finally the parietal peritoneum, which is the last layer that we can see in the anterior abdominal wall. Now for this layers, we're going to look at it in details in the course of this class. So let's talk about these layers one at a time.
So the first layer is the skin, as you have initially said, and the skin on the anterior abdominal wall is thin when compared to that at the posterior abdominal wall. The skin on the anterior abdominal wall has lines, and that line is called the Langer lines or the cleavage lines. This line runs horizontally, and these lines are being formed by collagen fibers within the dermis. Now, whenever incision is made along or parallel to the lines, those incisions tend to heal faster without much scarring. But whenever an incision is made across the lines, it tends to result to wide, ugly, heaped up scars. More so, the skin covering the anterior abdominal wall is relatively mobile over the underlying layers, except at the umbilical region where it is fixed. So the next layer we're going to talk about is the superficial fascia, which consists of 2 layers, an outer membranous layer, which is also referred to as the campus fascia, and an inner fatty layer that is referred to as the scarpus fascia. The campus fascia divides or separates the skin from the muscles and plays an important role as a protector and insulator to the deep organs that we can see in the abdomen. At the campus fascia, it is where we can find the superficial epigastric vessel, so it's often used as a marker for identifying the superficial epigastric vessels. This is because it is located between the scarpus fascia and the campus fascia. Now, the scarpus fascia, which is also referred to as the inner membranous layer, is also called the Thompson's fascia. This fascia is a dense collagenous connective tissue layer that is lying below the campus fascia. So the scarpus fascia is thinner than the campus fascia. And the scarpus fascia is continuous with the coalesced fascia of the perineum. There is no deep fascia in the anterior abdominal wall. This is to allow free movement of the anterior abdominal wall during respiration. Finally, I want you to note that the scarpus fascia, which is the inner membranous layer, is firmly attached to the linea alba, the perineum, and the inguinal ligament. This fascia passes below the inguinal ligament and it continues with the fascia lacta of the thigh. So the next layer after the superficial fascia is the muscles. I've already told you that it consists of 3 oblique and 2 vertical. Now, for the oblique muscles, we are going to be talking about it based on their direction of fibers. So the external oblique, its direction of fiber is downwards and medially. The internal oblique, it moves upward and medially, while the transversus abdominis muscle, its fiber moves horizontally. Now, the fibers of the oblique muscles tend to run in different directions. This is in order to strengthen the anterior abdominal wall and prevent the formation of hernia. Now, the second class of muscles that we can see in the anterior abdominal wall are the 2 vertical muscles, which are the rectus abdominis and the pyramidalis muscle, which I already told you it may not always be present, okay? Now, the next layer after the muscles include the transversalis fascia. Now, the transversalis fascia tends to separate or is located between the inner surface of the transversus abdominis muscle and the peritoneal fat. So after the transversalis fascia, the next fascia that we can see in the anterior abdominal wall is the peritoneal fat. This fascia is located between the transversalis fascia and the parietal peritoneum, which is the last layer of the anterior abdominal wall. The thickness of the peritoneal fat depends on the body mass index of the individual, okay? But the peritoneal fat is always thicker at the lower part of the anterior abdominal wall. So the last layer is the parietal peritoneum. The parietal peritoneum is the last layer, as I've initially said, and it is loosely attached to the anterior abdominal wall due to the existence of the preperitoneal fat. So let's talk about the arterial supply of the anterior abdominal wall. So we have 3 superficial and 6 deep arteries. So for the superficial artery, we have the superficial epigastric artery, which is the first one. The second is the superficial external pudendal artery. And finally, we are having the superficial circumflex iliac artery. So all these arteries are branches coming from the femoral artery, as you can see. So the superficial epigastric artery runs upwards towards the umbilicus, while the superficial epigastric pudendal artery runs medially to the external genital organs. And finally, the superficial circumflex iliac artery runs laterally to the iliac crest. So for the 6 deep arteries, we have the first one, which is the superior epigastric artery. Now, we have the classifications of the 6 deep arteries: 2 from above, 2 from below, and 2 from the side. So for the 2 from above, we have the superior epigastric artery and the musculophrenic artery. So these arteries are branches coming from the internal thoracic artery, okay? And you know that the internal thoracic artery is a branch of the subclavian artery. So the 2 arteries from below include the inferior epigastric artery and the deep circumflex iliac artery, as you can see. And those 2, that is the inferior epigastric artery and the deep circumflex iliac artery, are branches coming from the external iliac artery. Then finally, we have 2 from the side, that is from the aorta. We have the intercostal arteries and the lumbar arteries. So there's an important thing to note in the arterial supply. The superior epigastric artery anastomosis with the inferior epigastric artery, okay? This anastomosis would connect the subclavian artery to the external iliac artery. Now, the inferior epigastric artery, I already told you, comes from the external iliac artery, and the inferior epigastric artery lies medial to the deep inguinal ring, okay? Now, this inferior epigastric artery is important because it enters the rectus sheath and anastomosis with the superior epigastric artery. So its venous drainage includes 3 superficial veins and 6 deep veins. So the 3 superficial veins include lateral thoracic vein, which is seen superiorly and drains into the axillary vein. Then inferiorly, we have the superficial epigastric vein, which terminates at the great saphenous vein, and from the great saphenous vein, it terminates into the femoral vein. Now, the superficial epigastric vein and the lateral thoracic vein forms an anastomotic channel, which is called the thoracoepigastric vein, that connects the axillary vein with the femoral vein. Now, this anastomosis is very important in vena cava obstruction. Finally, we have medially, the paraumbilical vein drains into the portal vein. Now, for the 6 deep veins, we have the superior epigastric vein and the musculophrenic vein that drains into the internal thoracic vein. Then inferiorly, we have the inferior epigastric and the deep circumflex iliac vein that drains into the external iliac vein. Then we have the posterior intercostal veins that drains into the azygos vein, the lumbar veins that drains into the inferior vena cava. So for the nerve supply, we are having the lower 6 thoracic nerve, which is T7 to T12, and then we have the iliohypogastric and ilioinguinal nerve, okay, which is seen at the level of L1. So for the lymph drainage, we have the lymph drainage that we can see on the skin, and then those that are in the deep part, that's the deep branches. So above the umbilicus, we have the pectoral group of axillary lymph node, and below the umbilicus, we have the superficial inguinal lymph node. Then at the deep branch, it comes with the deep arteries that drains into the internal thoracic lymph node, the external iliac lymph node, and the para-aortic lymph node. So for the organs that we can see in the anterior abdominal wall, based on their regions. At the right hypochondriac region, we have the gallbladder, the right parts of the kidney, the liver, and the small intestine. Then for the epigastric region, we have the esophagus, the stomach, parts of the pancreas, the liver, and small and large bowel. Then for the left hypochondriac region, we have the spleen, the pancreas, the colon, and the left kidney. So going to the lower part, we have the right lumbar region. At the right lumbar region, we're having organs like the liver, the gallbladder, the ascending colon. At the umbilicus, we are having home to small intestines and also the belly button area or the umbilicus. Then at the left lumbar region, we have the descending colon and the left kidney. Then finally, on the lower part, on the last part of the regions, that's on the lumbar region. On the right lumbar region, we are having the ileum, the caecum, the vermiform appendix, the colon, and the right ureter. Then for the left iliac region, we are having the sigmoid colon, left ureter, and the distal descending colon. Then finally, on the hypogastric region, we are having the small intestine, the sigmoid colon, the rectum, urinary bladder, right and left ureters. Now, I want you to know that depending on the sex of the individual, both the left and the right lower quadrants contains either the ovary, the uterine tube, the urinary bladder, the uterus, or the ductus deferens. Okay. Now, the uterus, the ovaries, that's both right and left ovaries, the fallopian tubes can be found in females, while the ductus deferens, seminal vesicles, and prostrates can be found in males. So this is a diagram that shows a clearer picture of the organs that we can see in the anterior abdominal wall based on their regions and also on their plane. As you can see that the liver is located in the right hypochondriac region, the epigastric region, and the right lumbar region.
Let's talk about the variation that we can see amongst individuals. So the first is arrangement of innervations of the rectus abdominis muscle and overlying skin. So there's a variation in the arrangement of innervation of the rectus abdominis muscle and the overlying skin that we can find in the rectus abdominis muscle. There's also a variation in shape and position of the arcuate line. Okay, so the shape of the arcuate line might be different in some individual and also be different in another individual, as well as its position. Okay, now the next variation you're having is variation in components of anterior and posterior rectus sheath. Please watch my video. The next is the presence or the absence of pyramidalis muscle. I earlier said in the course of this class that the pyramidalis muscle may not always be present. Then the next variation is variation in number and location of the tendinous intersection of the rectus abdominis muscle. Now, the rectus abdominis muscle, or the rectus sheath rather, presents a tendinous intersection where you can see the rectus abdominis muscle. Okay, so please watch my video on the rectus sheath for you to understand the location of the tendinous intersection of the rectus abdominis muscle. So finally, we are going to be talking about the clinical anatomy of the anterior abdominal wall.
So the first you're having is inguinal hernia. So this is an abnormal protrusion of the peritoneal cavity into the inguinal canal. It can be classified as direct and indirect inguinal hernia. Now, for the direct hernia, it is formed when the hernia sac protrudes directly through the posterior wall of the inguinal canal. That is why it's called direct. Now, indirect inguinal hernia occurs when a portion of the intestine or the abdominal tissue pushes through a weak spot in the abdominal wall at the inguinal canal. Now, in males, the hernia can extend down into the scrotum, while in females, it may pass into the labia. It is called indirect because it follows this natural passage rather than pushing directly through the abdominal wall. Inguinal hernia is more common in males than in females because in males, the testicle starts inside the abdomen and has to go down through an opening in the groin area in order to reach the scrotum, okay? Also because the male have a wider inguinal canal than the female, So the next one is abdominal trauma. This is defined as a variety of injuries to the abdominal wall and its contents, that is the intra-abdominal organs and the intra-abdominal vessels. Now, depending on the mechanism of injury, it can be classified into blunt and penetrating trauma. So the first diagram you are seeing that has a bloated stomach is a blunt abdominal trauma, okay? Now, the area or the organs that are most likely to be affected in a blunt and penetrating trauma includes the spleen, the liver, and the kidney. So guys, you have come to the end of this class. Thank you for watching. See you guys in my next video. Please do not forget to like and share and subscribe. Bye.